Haematology. Haematology is the branch of medicine that studies blood, blood-forming organs and blood diseases. Red blood cells, erythrocytes. Erythrocytes are cells in the blood that carry oxygen from the lungs to the rest of the body. White blood cells, leukocytes. Leukocytes are cells in the blood that are part of the immune system and help fight infections. Platelets, thrombocytes. Platelets, thrombocytes, are small cell fragments in the blood that help with clotting to stop bleeding. Haemoglobin. Haemoglobin is protein in red blood cells that carries oxygen from the lungs to the body's tissues. Haematocrit. Haematocrit is the proportion of blood volume that is occupied by red blood cells. Anaemia. Anaemia is a condition in which the blood doesn't have enough healthy red blood cells or haemoglobin. Leukemia. Leukemia is a type of cancer that affects the blood and bone marrow, leading to the overproduction of abnormal white blood cells. Lymphoma. Lymphoma is a type of blood cancer that originates in the lymphatic system, affecting lymphocytes. Thrombocytopenia. Thrombocytopenia is a condition characterized by low levels of platelets in the blood. Haemophilia. Haemophilia is a genetic disorder where blood does not clot properly due to the lack of certain clotting factors. Sickle cell disease. Sickle cell disease is a genetic disorder where red blood cells become misshapen and can cause blockages in blood vessels. Bone marrow. Bone marrow is the soft tissue inside bones that produces blood cells. Complete blood count, CBC. Complete blood count, CBC, is a blood test that measures the levels of red blood cells, white blood cells, and platelets. Erythropoiesis. Erythropoiesis is the process of producing red blood cells in the bone marrow. Iron deficiency anemia. Iron deficiency anemia is a type of anemia caused by a lack of iron, which is necessary for producing haemoglobin. Plasma. Plasma is the liquid component of blood that carries cells and nutrients throughout the body. Coagulation. Coagulation is the process by which blood forms clots to stop bleeding. Thrombus. Thrombus is a blood clot that forms in a blood vessel or the heart. Anticoagulants. Anticoagulants are medications that help prevent blood clots from forming or growing larger. Haematologist. Haematologist is a medical doctor who specialises in diagnosing and treating blood disorders. Ferritin. Ferritin is a protein that stores iron in the body and releases it when needed. Hemolysis. Hemolysis is the destruction of red blood cells before their normal lifespan is over. Myeloma. Myeloma is a type of cancer that forms in plasma cells, which are a type of white blood cell. Erythrocyte sedimentation rate, ESR. Erythrocyte sedimentation rate, ESR, is a blood test that measures how quickly red blood cells settle at the bottom of a test tube. Fibrinogen. Fibrinogen is a protein that is essential for blood clot formation.